Remember, at the jaw joint, the first part of opening is just a hinge movement, but after that, there's some anterior translation. The mandible slides forward as you go further into the range. So it's helpful if you say to the patient, push your jaw forwards a bit as they work into this. So what can you do? So the straightforward active exercises. Ask the patient to open their mouth as wide as they can, remembering to tell them to push your jaw forwards a bit as they do it. You can also get them to do lateral jaw movements and protrusion and retraction forwards and backwards like this. Those movements really do help loosen up the joint, and in fact we do use some of those movements when we're chewing things, when we're eating. You can also do passive stretches, quite simply with your finger. As long as there's enough room for you to get your finger in, you can slot it in. If there isn't enough room for that, you can grasp at the chin and gently pull down. They can do that themselves, and you can also get them to put tongue depressors and stack them up into the mouth to stretch it. There are some special devices that you can buy to help provide a stretch at the mouth. A very common one is called the TheraBite. But I have to say, I'm a big believer that you get a good effect with your fingers and you can feel what's going on well. So I'm rather in favour of just use your hands. Now, isometric jaw exercises, they work really well to improve function in the area because they also strengthen the muscles operating on the joint. By the way, the muscles that operate on the joint, on the temporomandibular joint, there's temporalis, masseter, and then the medial and lateral pterygoids. Those are the only muscles in the face that are not supplied by the facial nerve. Those four muscles are supplied by the trigeminal nerve. But anyway, isometric work. So this is where you apply pressure, which blocks the movement. So you get an isometric strengthening. So for opening, fingers underneath, try and open. For closing, fingers there. And of course, the patient can practice these themselves. For a lateral swing, thumb on one side, on the other. And don't forget the protraction. Get them to try and push forward. I often have the patient do several repetitions of some isometric work of all those movements before I then go on to do an active or a passive stretch into opening, because they work really well to help loosen up the joint.